Precision starts with great immobilization. You asked for setup tips, and we're answering with one of our favorites for getting the most out of the AIO 3.0. So here we have a supine left breast patient on the AIO incline breast cushions. So this is a 10-degree cushion. You can also do 5 or stack them and get 15 degrees. So a lot of options there. As far as the hands go, this patient has the mobility to reach out pretty far, and that's where I would start everybody if they have that mobility. And then if they don't, I kind of like bringing this one in here and stacking the hands like that there. But whatever you're trying to do, I like to bring the elbows and make sure they're inside the cushion as much as possible. But for this case, we'll bring it back since she has the mobility. Bring her here.
I agree. I think full extension, if achievable, is ideal because that's how you're going to bring the arms internally enough to avoid any clearance issues. We also have the availability to use masking for these patients. So if you do want something like a chin strap to keep the chin turned in a specific direction, this secondary base plate can be placed on top of the cushion. Chin strap can go right here just like any normal mask would. We also have slots on the base plate if you want an actual mask for the breast or anything like that.
I prefer not to use masks if I don't have to. Unless you have something like it's a really high super clap, then I would use a mask there. But as far as the reference marks go, every one of our AIO cushions has this indention mark as a reference mark. So you can scoot the patient to the cushion itself.
So you can see right now we have the laser lined up on this indention on the cushion. Depending on patient's anatomy, this might not be the best area for marks. If you have loose skin, loose tissue, things like that, obviously something that's going to be movable every single day may not be the best place for marking. So if that is the case, we do have a reference point right here on the board. And for that specific patient, I would drive this table in a little further. We'd mark that laser right on that line, just like that. And then now we can mark patient's body right here.
Great setup mark there.